Hello, everyone, and welcome to another episode of Office Hours. I'm your host, as usual, Stuart Newsom, and today we have a very special guest with us. Don Siemens is with us. He's the research director from KLAS, and we're going to dive into a extremely data-rich discussion titled 2025 RCM Outsourcing and Tech Roadmap from KLAS Research. So, and when I say data-rich, it's data-rich. Don will get a little more into that. So I just want to welcome you, Don. Thanks for joining us today. How are you doing?
Man, yeah, I'm doing really good. I'm really happy to be here, Stuart. Great to talk with you and
Oh,
everyone
awesome,
else.
awesome, awesome. So if you could just tell us a little bit about yourself, your background, and also for those who may not be aware of KLAS, and that's class with a K, KLAS,
That's right.
just kind of a little bit more about what KLAS does and the importance it is to healthcare.
Yeah, absolutely. We'll start with that. Let's start talking about KLAS. It's an organization that's been around more than 25 years, and it got its start with someone named Kent Gale. The K in KLAS is for Kent, and Kent's still around, but he had this idea: if we could make healthcare technology, add some transparency to the healthcare technology industry, then that would really help providers. It would make them help them make good decisions, and because they're putting all sorts of effort and resources into buying this technology and then using that technology to make a difference for patients. So that was Kent's brainchild, and it's through lots of hard work and a lot of effort and a lot of working with great organizations like Infinix. Um, we, uh, we now rate. Gosh, I wish I had those numbers off the top of my head, but I don't. But more than 1,000 technologies, hundreds of vendors, and lots of solutions. So we're basically like a healthcare technology consumer reports.
Hmm.
If you're a healthcare provider and you want to know what's going on in the healthcare technology industry, go to classresearch.com and you can find out. All the data is available to healthcare providers for free. And we just do it because we feel like if you know what works, and you choose the right solution for you, then your healthcare is going to get better, and it's also going to help the solution providers make their solutions better. So that's about KLAS. I've known about KLAS for a long time, but I've this is going on a little bit more than a year that I've been with KLAS. I've been in the healthcare technology field for quite a long time. I worked for 5 years in Intermountain Healthcare here in Utah, where I live and work, and then I worked in the technology space, the healthcare technology space, for probably 18 years total before I came to KLAS, and it's just been a great experience. I love working in healthcare. I love working with technology companies, and it's just a great career choice. I recommend it
Yeah,
to anybody.
a lot of job security with all the changes that goes
That's
on
true.
through
That's always true.
right, right, right. So, and from that, what you just described with your background as well as KLAS, I want the audience to understand that the information we're going to share today is just so relevant, and KLAS is just the perfect vehicle to bring this data. And that is, we're talking about those trends for 2025. So we're going to cover some of those pressing trends, particularly in priorities for RCM and healthcare IT
Mhm.
as we look forward to 2025. So Don's going to share some insights from the latest KLAS research that they've collected over the last year, touching on those top priorities like the IT infrastructure, things like clinical workflows, denials management, patient access, and how outsourcing in particular and automation play crucial roles for all of that. Um, so before we go into all this, I just want to remind everyone that we will have a Q&A session at the end. I encourage you to input your questions for Don or even for me in general. We'll answer those questions to the best of our ability once we're at the end of this episode. So just want to dive right in to the episode or into the Q&A that I will have with Don. But Don's going to share, some insights. We typically don't have a PowerPoint presentation, but we felt it was important to kind of show some graphical elements from the research that KLAS has done. I know that that those who will be listening to the podcast don't have that visual, but we're going to really do a good job of describing and articulating, what those slides convey, so to speak. So, Don, if you could, I guess, share your um, PowerPoint, we can get started.
Yes, sir. Happy to do that.
Okay. I know we're going to get started, to kind of paint a picture of what this slide is entailing. We're going to start by looking at some of the overarching trends that are influencing RCM as we approach 2025. So, Don, you're going to really unpack several areas of this report in a little more detail. But can you start by sharing, what some of these big picture trends mean for providers?
Yeah, absolutely. So first and foremost, I think I need to describe where this data comes from. Every year, we work with a company called Bain Consulting uh, on purchasing trends. What in the hospital space, obviously, and this is the third year that we've done that. And so a lot of what I share today, most of what I share today, is going to come from that report. And so what I have showing here on the screen are the three big takeaways that come from that data research. We've reached out in this space. We reached out to 50 payer executives, 100 provider executives, and we asked them some similar questions. Most of the data that I'm going to share today is from the 100 provider executives that we were able to speak with along with Bain. But the three takeaways that we got from this are around technology and analytics being essential. I'll show you in the next slide buckets of where that spend is going, and most of it's going into technology and analysis. And then the second takeaway from that is that organizations, both in the payer and the provider space, are focusing on ROI, not only long-term ROI, but really trying to get the quick wins that are coming through or that are available through technology and services. And then I don't think anyone's surprised to know that people are talking about artificial intelligence and the gains that that's making over the last few years.
Mhm. Yep, indeed, indeed. And of course, one other aspect that we're seeing is a strong focus on measurable ROI. And an ROI can mean, different things for different people, different
Sure.
personas. But how can providers balance the need for quick wins? Because, there's things that need to be done immediately, stat, if you will, with the need for long-term investments in RCM. Because many of these solutions aren't cheap, right?
Right. Right. So overall, I think that emphasis on ROI is because we are just working in a challenging environment right now. Healthcare is not easy. It's not easy to get a margin.
Mm,
So providers want to ensure they get paid for the services that they provide. They want to ensure that they attract and maintain those patient populations. They want to make sure that they manage their labor costs. And so what they're looking to do is get those quick wins in when they're pulling, especially new providers and new technology providers.
mhm,
One way to get quick wins is just to use the technology that you already have and use it really well, specifically with your EHR provider.
mhm,
And we're seeing that's a big trend that organizations are looking for. If they need something, they're going to see if their EHR provider gives it to them because they feel like they can get quicker ROI if it's something that their EHR provider provides. And honestly, when we've spoken, and this is probably more focused on providers than it is payers, but I think payers feel this way as well. They're all saying that they really want to realize significant value in the first year. And so
mhm,
if someone can promise that value within the first year of using whatever solution there is involved here. That's really what they're going for.
Yeah, it's more like instant gratification and how can you get me there? And
Yeah,
yeah,
absolutely.
yeah,
And they're not just looking for the instant gratification. They are looking for long-term ROI as well. But just in the tough environment that we're in, specifically related to the economy that we're dealing with, as well as with the regulatory environment, that's just become more and more important.
right, right. And you make an excellent point as well as look around and see what you already have. Are you utilizing it to optimization that you need? Is there something you didn't know was there? Check with your existing partners from a technology standpoint, and also even from a consulting standpoint. There may be non-tech things that you could possibly do to maximize some ROI within your organization.
Yeah,
Um,
100%.
yeah, so going to the next slide, to me, this next slide show the specific IT and data priorities for providers. So, Don, RCM ranks pretty high here among IT priorities.
Yeah.
In your view, what does this signal about the current state and future of healthcare finance?
Well, I think that the interesting thing when I first looked at this data, and this is data from that Bain research that we have discussed, um, RCM last year was a top three priority. It was like the number two priority in our research. In this research year, thinking about 2023 and focusing on 2024, um, the IT infrastructure and workflow, clinical workflow came before, and data platforms interoperability. I'm trying to read this very small slide with my old eyes, so I apologize for stumbling over this a little bit,
No.
but it makes sense when you look at the environment that we found ourselves in 2024. I don't think that cybersecurity was high on the list, but it became really high on everyone's list in the latter part of February of 2024 with what happened in the Change Healthcare space.
Yep.
So that was obviously a kind of a black swan that it shouldn't have been a black swan. We should have seen it coming, but it was.
Mhm.
And so um, RCM, it's still a high priority. It's still a top four priority, and it's a high priority because it's it's ROI. We talked about how hard it is to maintain the margins that you need to maintain, and it's not just because of the regulatory environment. It's not hard just because of the economy, but consumerism is an issue.
Mhm.
The tough labor market is an issue, and people look to RCM solutions, and they're trying to streamline those processes so that those do feel like quick wins for healthcare leaders.
Yeah, certainly, certainly. And I can tell from the slide with, the IT infrastructure at 38%, clinical workflow optimization 35%. To me, that speaks to making sure the technology is efficient and your operations are efficient. But then, to your point, slowly, coming right neck and neck with them is revenue cycle management, 31%.
Mm-hmm.
And revenue cycle management, it'd be interesting to see how that's broken down a little further, because there are different segments of revenue cycle. Because if you look at end-to-end revenue cycle, you're talking, things like charge capture, documentation, coding, charge entry, payment posting, denials, AR, the whole gamut. There's so much more involved in there. That's why revenue cycle is so hard. There's so many different facets to it that if one thing goes wrong, it affects everything else. So it's no wonder that that's high on the list. And then patient access at 29%. That's up there as well. That there's issues with
Yeah.
patient access for sure.
Yeah,
Um,
I was advancing the slide, so I apologize, but yeah, there's definitely those two things go together. They're heavily involved, and all of this kind of flows up to the one, maybe not one the one, but one of the overarching takeaways is that organizations want to streamline. They want that quick win. They want to improve their revenue and keep their margins high. And one of the ways they're going to do that is through the technologies that streamline their workflow, streamline their processes.
And on that point, from the provider's standpoint, if you will, um, how do IT infrastructures and those workflows directly impact RCM management and patient access efficiencies?
Well, I don't know how they directly do it. I do know that as organizations invest in IT infrastructure, as organizations invest in clinical workflow, the end goal, from what we have heard, is that these organizations want to improve their workflow. They want to improve their processes. They want to make things streamlined. They think the more you can simplify, and this is true for consumers, this is true for the providers and the staff that work on the back end, the more we can simplify things for them, make it easier for them to do their jobs, or to do the job that they're even patients have jobs to do, right?
Right.
The more that we can streamline that and make it simplify it, the stronger the ROI is going to be. So if you're improving your infrastructure, that's going to improve things downstream in the revenue cycle. If you're improving your clinical workflow, then that's going to help in the revenue cycle too. We sometimes forget that the revenue cycle really depends on documentation to get good revenue. You have bad documentation, you can have bad revenue. Let's just have a good
right. And it is the old saying, and it's just I've been doing this 29 years myself, and from year one to now, if it's not documented, it didn't happen.
Didn't happen. That's right.
It's just, and that's with everything. That's with everything. Everything requires documentation to back it up.
Sure.
And I think when you talk about technology, it's all about, and here at Infinix, we like to call it orchestration. And because you have automation, which is typical RPAs, taking care of the mundane things, then you have cognitive AI, generative AI, if you will, most people will call it, where there's reasoning going on with a combination of that. And with those two together, as well as adding some human element too, because I think again, it's an orchestra. They're all playing together to accomplish and streamline things where you have, because the bots can't do it all, and generative AI can't do it all. And certainly human beings have been doing it manually for a long time, but when it's all put together with what we like to call tech plus services, it can be very, very efficient. So there's data definitely to support that. So moving to the next slide, here we see where providers are specifically investing in RCM and patient access. Would kind of want to point that out. Denial management, self-scheduling, both of those are particularly high priorities. So with that noted, and both of those as top priorities for RCM and patient access respectively, how are organizations tackling these areas through their technology investments?
Well, I'll tell you this, denials management has been, you've been in this for 29 years. I've been in it for more than 25. I think this is a term that we've heard over and over and over again. And the more things change, the more they stay the same. It's just so difficult to stay on top of your denials. And there's not a silver bullet to fix that. So denials management, complex claims, those are always going to be important. I'll tell you this, I was at a summit that KLAS put on a couple of weeks ago, and we brought in vendors, we brought in providers, and a few investors even. There was 135 of us in the room, and we were just talking about revenue cycle challenges and revenue cycle solutions. Denials management, generally, prior authorization specifically, was not on the agenda, but those two things came up consistently throughout that day and a half that we were together. these are just things that people think about and care about and have to worry about all the time. So when it comes to denials management, and this came out in that summit that we attended, and some Infinix folks were there as well, but it also came out in the data that came from this Bain KLAS research. People are looking at root causes. They're looking at causes, and we mentioned documentation. There's that's a root cause for a denial. Coding can be a root cause for a denial. Prior authorization problems can be root causes for denial. So that's very important. On the self-scheduling side, I think this is interesting. All of us are patients. Everyone in the audience probably has seen a self-scheduling app. If you haven't, then I'd be surprised. Give me a call and let me know that you haven't seen that, and I'd like to get your experience and how that's how your experience is played out. But self-scheduling is an important thing, and that data point shows that organizations want self-scheduling. There are some issues with implementing self-scheduling. There's issues around the providers being bought into self-scheduling. Sometimes that's not the easiest thing to do, but it's 96% of the organizations that we speak with say we've got to do self-scheduling. That's their A1 priority when it comes to patient access. But then there's these other areas that we just talked about before about denials. If you start the patient access process and you start getting information wrong, you're going to get a denial. And that's it all kind of runs together.
Right. It's all about communication. Are you communicating the right information at
Mm,
the right time for the right patient?
that's right. And I think that
Right person.
organizations feel like self-scheduling is going to help them get that right.
Right. Right. I've had personal experience with self-scheduling, and I bar it was a great experience for me.
Mm,
Of course, I'm familiar with technology. You may have
sure.
some others. It's really going to depend upon the user. And there are some users that are probably not going to be comfortable with the technology or understand it. But I think that'll improve. I mean, I think
Mm,
as self-scheduling gets out there, it'll be used more and more and more. You can say the same thing about cell phones, say 20 years ago, right?
yeah.
It's like, or even a camera on the phone. Can you imagine how ridiculous that sounded back then? But
Yeah.
now, but I think the more things people get used to it, then it just becomes, second nature or expected. It's like, oh yeah, I'm gonna
Yes.
schedule myself.
I agree, and it looks like it's going to become ubiquitous just based on the data that we're seeing right here. If you haven't done self-scheduling, if all of your providers don't do self-scheduling, they will be.
hmm Exactly, exactly. So, and then with you talk about patient access becoming a central focus as well, according to these stats. What are some technology solutions you see leading the way for improved self-scheduling and check-in processes?
Well, there are lots of options, but what we see winning out are the options that again make it dead simple, not only for the patient but for the person who typically, we talk about their self-scheduling is going to be ubiquitous, and our grandchildren are probably going to be like, well, you had to talk to somebody to before you talk to the doctor. You had
Right.
to that seems so weird. Why would you need to talk to somebody when you can just use your phone, right?
hmm
Whereas people in our generation, that's the way that we grew up and that's the way that we lived. But
Right.
um, there are lots of options out there, and the ones that are making it as simple as possible are going to be the ones that are winning. Ones where you don't have to go to a specific website. They don't say, "Hey, go to this website and make it happen."
hmm
They feed that link to you, and you just do a quick link on your phone. The ones that don't make you download an app,
mm
right?
Yep.
Those sorts of solutions just add steps, add complexity. Even if it's just a tiny bit of complexity, it still adds complexity. Ones who say you don't need to give us a username or a password. We just need to know it's you, and we're going to verify it with a couple of questions.
Exactly.
If you can simplify it, then it's going to be the solution that patients and that your back end staff are going to want to use, or your front end staff actually, not back end.
Yeah, right. Right. That's awesome. That's awesome. Yeah. So, and I couldn't agree more. I mean, you just got to make it simple, and make it, tear down those obstacles, because once a barrier pops up, then your adoption is going to plummet. So, definitely the ones that make it easier, make an easier path to usage are the ones that are going to win. So if we move to the next slide, we can see that we dive into some of the top challenges with revenue cycle technology, like denials management, prior authorizations, and where technology can basically make an impact. So, like for instance, denials management prevention was at about 25%. Automation and work prioritization was about 14%. Or work prioritization, I should say, was at 14%, and then prior authorization was at 13%.
If I
So
could stop you, and just to share with you a little bit more, share with the audience a little bit more, especially those who are listening and not watching, there's not a percentage next to these numbers. We spoke to 34 people about these questions, and 25 out of those 34, so a very high
sure,
percentage, talked
yeah,
about automation within the revenue cycle. 14 out of 34, so that's still a very high percentage of talking about prior authorization. So
yes, yeah.
apologies
Thanks.
for that.
No, thanks for that
It
clarity.
was a little
Absolutely.
unclear. Yeah.
Right, right. No worries. Well, in automation is definitely an area of interest that we see here. So, especially in work prioritization, as well as prior authorization. You just, saying those two phrases together can really be a tongue twister for sure. Uh, but what role do you see automation playing in addressing staffing challenges in revenue cycle? Because we certainly, when we speak to prospects, customers, potential customers, even, staffing is a top problem that they have. So, and we're always talking about how automation can address those, but
Mm.
just like to hear your take based on this data.
Yeah, I think you're right that staffing challenges are the biggest reason why organizations are turning to automation. I mean, automation is an interesting concept. People want to get more efficient, regardless of how many staff they have, but it makes it even more difficult or even more attractive because of the difficulties that have arisen really around COVID and post COVID. It's just hard to staff. It's hard to staff the revenue cycle. It's hard to staff the patient access, which is a
Mhm.
little bit more. It's not as specialized. You don't need a lot of skill necessarily on the patient access side, but the middle revenue cycle and the back end revenue cycle, especially, those are just very difficult because you do need a little more certifications when it comes to those areas. So automation is very attractive in those spaces. And the way that we see it playing out is whether people are turning to just traditional automation services or robotic process automation or machine learning or large language models. Most of that is being used to streamline non-patient facing processes.
Mhm.
And the patient facing processes, the processes where, especially at patient access, and especially when you're talking to someone about getting their bill paid, um, those are the more simple, repeatable processes are the ones that people are turning to for automation. In the middle revenue cycle, when there's not a lot of patients who are involved, it's still focusing on really the simple things, the simple repeatable things, and then those coders who are and the folks who are working on clinical documentation improvement, those folks are focused on really the higher level, more complex challenges that they see in those spaces.
Certainly, certainly. And that would certainly apply to prior authorizations as well, because we see that that definitely
Mm-hmm.
still remains a main pain point for many. It still tops the denials list of, one of the main
Yeah,
reasons denials occur.
it
Do you
does.
see similar trends in how providers are leveraging technology or
So
outsourcing?
honestly, it's for us, it's too soon to tell.
Hmm.
And I want to tell you about a research project that we are just in the middle of. This is just KLAS that's doing this. We're doing this on our own. We're reaching out to providers across the country who are doing prior authorization, and we're asking them how that process is playing out for them. What technologies are you using? Are you using multiple technologies? Are you using something as simple as a spreadsheet and that's it? And I'll be
Hmm.
honest with you, surprisingly, There
Yep.
are some providers who are doing that. And I
Yep.
asked him why. I'm doing some of this research on my own, and we've got a whole team that's working on this. And people are just saying, well, sometimes the technology just doesn't meet our needs. And so it's even though it's time consuming, it's a little more costly to use this technology. And so just overall, it's cheaper for us to do it on our own. That's not the case with everybody, but that's the case with a few people. So um, I only use that as an example. That's not. It may be a research finding. I'm not sure if that's a research finding that we're going to come up with, but
Mhm.
we definitely are talking to people who are using technology solutions that have that automation within their process. And I think I'm hesitating a little bit because again, the research project isn't quite done yet. But I think that we're going to see a lot of organizations who are using multiple technologies, multiple
Mhm.
processes, multiple workflows. There are some organizations like Infinix and like some other organizations that we've spoken to from a KLAS perspective who are providing or offering an end-to-end solution. Not
Mhm.
everyone's using that type. When I say end-to-end, I mean it's a solution that hits all of their prior authorization needs,
Mhm. Exactly.
and it hits it from a specialty perspective, it hits it from a payer perspective, and from the steps in within that process. And organizations like yours are making that available. uh, we're not seeing a very wide uptake of that yet, but I think that's where the industry is going, is more of a less of a something that focuses on a specialty or something that focuses on just one payer or a handful
Mhm.
of payers, something that's more comprehensive.
Well, I know we're trying to do something about that. I promise you.
Yes,
So
yes.
but yes, we see that trend as well.
Mm.
And when we speak to potential customers, we do find spreadsheets and manual
Yeah.
processes and siloed processes, even especially with larger organizations, because everyone's kind of have their own way of doing it. It's not centralized or aligned with, say, how it should be done on a corporate level to streamline things. Um, so on our final section, as we advance to this is our last slide, I promise. It focuses on the implementations of technology and outsourcing as we move into 2025. So here we see the rise of AI and automation, RCM, and patient access. So as we look ahead to 2025, what advice would you give revenue cycle leaders considering RCM outsourcing or any new technology investments, particularly, qualities or capabilities that should prioritize in a partner?
Well, just based on the research, and this is where these key takeaways are on this slide. It's based on some of the research, mostly what we've heard from Bain, but some of the other research that we've done around outsourcing. Um, it does seem like organizations are prioritizing IT infrastructure, they're prioritizing patient access, they're prioritizing self-scheduling and revenue cycle. And I think overarchingly, it's it's all kind of funneling into the patient experience. This is how I see it.
Mhm.
If I'm looking at all of these priorities and why organizations are purchasing them, it really does funnel down to that experience, um, to the patient experience, and it also funnels down. I wouldn't say to a lesser extent, probably to an equal extent, to the staff experience, to the clinical experience that organizations are having.
Nice. So,
Providers are seeing that they can't survive. I don't want to have a catastrophic language here, but so
yeah.
survive may not be the right terminology, but they can't succeed if if they continue to do things the way that they're doing them. They have to find ways to
Hmm.
streamline. They have to find ways to make workflows easy and to simplify it. And that's going to be true for their clinicians. That's going to be true for their patients.
Yeah, especially since the payer side is adopting a lot of these technologies and resources. So it's almost another reason you have to do it because the payers are using it as well.
You
So
know, Stuart, that's a great point. Just about at every event that I go to, it seems like there's a discussion about the AI arms race. And
mm,
that's true, especially as we were talking about prior authorization, that's true in prior authorization too. And I think it was a provider made a point a couple of weeks ago when KLAS had its summit on revenue cycle management that payers are in the lead, and they're probably not going to relinquish that lead when it comes to arms races, because what feeds AI? It's data, and payers have so much data, and
hmm
it's always been true. When it
right.
comes to payers and providers, payers are going to have more data than a provider does. And right now, payers are using that data to feed their AI systems and to solve their challenges related to prior authorization. And a lot of times we see that providers and payers are on opposite ends of that spectrum. But providers have their challenge with prior auth, payers have their challenges with prior auth too. And I'll just do a shameless plug if I can. There's a meeting that we have in May every year. It's another day and a half meeting. We call it the K2 Payer Provider Collaboration Summit, and we talk about ways that payers and providers are working together to solve mutual challenges. We have what's called a points of light case study presentation, and we have 25 of those at these at these events. It's typically around 25.
Mhm.
And we call them points of light because it's something that we can look to as an industry as a whole for payers and providers on ways that they are working together. And I'll tell you this, we had 25 of these points of light presentations last May, and 9 of those were about prior authorization.
Wow.
And these were great examples of payers and providers working together to solve a problem for a for a patient, or for a cohort of patients. So there are challenges for sure, but there's points of light within those challenges that we can see where there are good examples of organizations who work together to solve these problems. And then to the third point, we haven't talked a lot about outsourcing here, and you might have some questions about that. But I think overall, it's just important to balance the needs of your organization, because sometimes there's competing needs as a provider. You're thinking about your staff, you're thinking about your revenue, you're thinking about your patients, you're thinking about your clinicians, and outsourcing can impact all of that. And so, we've talked to organizations who are all in on outsourcing, who love it, who think it's a great thing. We've talked to organizations who think it's a necessary evil, we have to do it. And
Mhm.
there's opinions everywhere in between about outsourcing, but it really just there needs to be a focus on your specific situation and on what works for your organization and the community that you serve, because it even impacts your community.
Right. Exactly. Exactly. So, I mean, to wrap things up here, um, are there any emerging trends or insights from the latest KLAS research that you think revenue cycle leaders should keep on their radar as they plan for next year?
Well, I think it's always important to keep an eye on AI. I think the the prevailing sentiment is that we want to not use AI for AI's sake. We want to use AI to solve a
Mhm.
problem. AI is a tool in your tool belt.
Mhm.
So that's where your focus ought to be. Uh, and again, this is me telling you that this is what we've heard from both payers and providers.
Sure. Yep.
In terms of other trends, uh, I think what just sits with me is that there are going to continue to be challenges that we need to face using technology, using analytics, using artificial intelligence, um, and look, just look for opportunities to come together. I do think that fee for service is here to stay. In my opinion, this isn't
Right.
KLAS's opinion, but in my opinion, that's unfortunate. I've been in, we've been both in healthcare for so long, and for 10 years, I was hearing that fee for value was about to take over,
Yeah. Value-based
and
care. Yep.
yeah, value-based care was the thing that was, and it was going to be a process and it was going to be difficult, but eventually fee for value would overtake fee for service. But from everything that I've heard, that's not going to happen. I don't think fee for value is going away, but I don't know that it's going to take over fee for service anytime soon.
Yeah, I
So
agree.
let's continue to look for those ways that we can collaborate and find where our incentives align with our patients and with our payers, and and as we do so, I think things are gonna. That's the only way that we can make things better in healthcare in terms of revenue cycle. You just keep focusing on finding those processes that can be streamlined, finding those processes where you can take out costs. That's the trend for the foreseeable future. Is that's what revenue cycle leaders are looking to do.
Hmm. Yep. Because like you said in the beginning, it's all about margins,
Yeah.
and making those margins, and they're thin already. So you have to take
Yes.
full advantage of improving those margins as much as possible.
Yeah.
So nice. So we're going to wrap things up and open it up for the Q&A. As I said before, if you guys want to go ahead and put in questions in the Q&A spot, we do have one question, Don, and it has to do with I believe the data.
Okay.
It's the question is, when doing this research, um, was it from a specific overarching set of providers, or was it specially specific or large to small? Please elaborate.
That is a great question, and I don't have an exact answer, and I apologize for that. What we have typically done, and I didn't look, and the reason I'm saying that is I haven't seen the the specifics of the research, like where they came from in terms of large systems versus small community providers. But
Hmm.
I do know that in the past, it is not focused on one versus another. We haven't just limited ourselves to community hospitals. We haven't limited ourselves to large organizations. It's been a wide we cast a wide net,
Hmm.
and so what we can do is we can follow up and I can follow up with a specific person and get more detail about where that came from. I don't know how that breaks down, but I do know that we have in the past tried to cast a wide net.
Nice, nice. Yeah, I would imagine with all of the people that you research, I know traditionally you do a lot of research with certain providers, based on those you are, reporting on. Say someone like Infinix is typically that client base, but also I'm sure you reach out to others, use other resources beyond that. So I can imagine that there is a large variety of different specialty types, different sizes, whether a hospital, whether acute or ambulatory. I'm
Mm-hmm.
sure it's the whole gamut.
Yeah, that's I'm pretty comfortable saying
Mhm.
that, but I can follow up with some exact numbers.
Sure, sure. Okay. Well, there's really no other questions. So with that, Don, I want to thank you for joining us. I know you're a very busy person.
We're all
Uh,
busy.
we
It's okay.
we yeah, we love KLAS, and if you want to find out more about KLAS, be sure to check them out on their website. You can also reach out to us for any questions you have regarding automations, technology, the Text Plus services that I had mentioned earlier, in this broadcast. So please just feel free to contact us if you have any other questions once we conclude here. So thank you again, Don. It was great having you.
Pleasure to be here. Happy to do it whenever. Let's do it again.
All right. Thanks everyone for joining us. Y'all have a great week.